Why did the government break the barrier of not intruding on the food and drug market? Upton Sinclair's book, The Jungle, shows how unsafe and unsanitary the making of food and drugs were. Due to there being no regulation from the government, companies in the industry would use horrible practices like using seasoning in canned meat so you didn't notice the meat was expired, or mixing drugs with cocaine and morphine so that the medicine would give them a high and make them feel better instead of actually healing them and doing their intended job. Sinclair realized this and wrote a book to expose the industry, and the public was disgusted by the conditions of the food industry that was described in the book. Sinclair wrote, "This is no fairy tale and no joke. The meat would be shoveled into carts, and the man who did the shoveling would not trouble to lift out a rat, even when he saw one. There were things that went into the sausage in comparison with which a poisoned rat was a tidbit." The White House received hundreds of letters from the public about how they needed to fix the food industry and regulate it, and Sinclair even sent a copy of his book to the President Theodore Roosevelt. He read it and issued a federal investigation in the food industry and realized just how unsanitary the conditions were. Not long after this, Congress approved and Roosevelt signed off on the Food and Drug Act of 1906, which was the first regulation of any sorts on the production of food and drugs. This act would become the foundation of what would become the Food and Drug Administration. 5 years later, in 1911, a product called Dr. Johnson's Mild Combination Treatment for Cancer claimed that it could completely cure one's cancer, blatantly lying to get the product off the shelf. The inventor of this product argued that it was a medical opinion that it cured cancer, and since it was an opinion, he could state whatever he wanted, and this argument made its way to the Supreme Court. The case U.S. v. Johnson ruled that the Food and Drug Act only had regulation over the false advertising of ingredients that went into the medicine of food. They had no regulation or rule over what the companies said their drug actually did. They could lie and claim anything they wanted to about the drug and get away with it scot-free. They could lie about what the medicine actually did and to the extent it would heal you, if it would heal you at all. This was a big step backwards for the Food and Drug Act and gave the companies that produced medicine and drugs more power over the production of their products. This led to products like Mrs. Winslow's soothing syrup to be put on shelves, which claimed that it would stop babies and infants from teething, but really just relaxed them by giving them doses of morphine. These doses were lethal, though, and led to deaths of many infants at the time. In 1914, the Harrison Narcotic Act was passed, which required prescriptions for narcotics that were used in medication, and also required for pharmacists and physicians to start keeping records of who is on and had prescriptions for narcotics. Another step in the right direction, this helped pave the way for the standards of record keeping on pharmaceuticals and prescriptions. 13 years later, the FDA received another win with the US v. 95 barrels alleged apple cider vinegar in 1927, where the brand Sunbright apple cider vinegar claimed that they used fresh apples, but actually they would use dried apples and water as a substitute, and court ruled this as a different product and illegal according to the Shirley's Amendment. This reinforced the amendment and said that the Food and Drug Act would get rid of any medication that could falsely mislead the buyer, even if the statement was partially true. 3 years later, in 1930, the Food and Drug Act finally got the name that we know now as the Food and Drug Association, or the FDA.
In 1933, there became a need to revise the out-of-date Food and Drugs Act. In order to get a revision of the Food and Drugs Act and to persuade companies to change their products, FDA officials set out to receive and collect photos and products of items that are still problematic. Essentially, they intended to only show the exhibit of the photos and products to Congress and hoped to gain an updated Food and Drugs Act, but it ended up being an exhibit also for the public. Eleanor Roosevelt, who was also an advocate for the cause, viewed the exhibit, and a reporter that attended it with her gave the name known today as the American Chamber of Horrors. The majority of the exhibit was devoted to explaining different food products and how there needed to be a change in products. All required standards of identity of products in order for consumers to know what they're buying. Since neither price or packaging were reliable guides, an example of products' false packaging was egg noodles, to conceive people that there were only egg noodles. Another major problem was ice cream, because different ice cream brands varied in fat content. Labeling the ice cream would allow the buyers to know what they are eating. In the exhibit, they also talked about the McNary-Mapes Amendment and how it eliminated deceptive packaging in canned food would need to be expanded to other foods, so the consumer would not be tricked into getting products that look like there's a lot inside of it because of the packaging, but actually does not have a lot. The exhibit grew so popular and it was displayed at the White House and the Chicago World Fair. FDA's chief educational officer, Ruth DeForest Lamb, left her position to write a book exposing industry tactics and the weaknesses of the 1906 Act. In her chapter on food standards in American Chamber of Horror book, it helped persuade Congress for a need to change the outdated 1906 Act. 4 years later, in 1937, 107 people died, mainly children. Now, what caused 107 people to die so suddenly? During the 1900s, sulfonamide was used to treat strep throat infection. It was normally consumed in tablet form or powder form and was effective, but there soon became a demand for the medicine to be in liquid form. And a salesman from the S.C. Massageol Company in Bristol, Tennessee, reported these findings to the company. The chief chemist and pharmacist in the company, Harold Cole Watkins, began to get to work on developing the liquid form sulfonamide. He experimented and found that sulfonamide would dissolve in diethylene glycol. He then tested it for color, smell, and flavor. Once it met its standards, the company shipped 633 shipments of sulfonamide elixir around the country. At this time, safety studies did not have to be done on drugs. So, what was the elixir not tested on? Toxicity. Since no pharmaceutical studies have been done on the new sulfonamide preparation, Watkins failed to note one characteristic of the solution. Diethylene glycol was normally used as an antifreeze, which is a deadly poison. The first reports were on October 11th. The American Medical Association received reports from the physicians in Tulsa, Oklahoma, that an unfamiliar sulfonamide compound was responsible for the number of deaths. The American Medical Association asked for samples of the drug and then wired the Massageol Company requesting the composition of the compound. The American Medical Association laboratory isolated diethylene glycol as a toxic ingredient and immediately issued a warning through newspapers and radio that elixir sulfonamide was toxic and deadly. Once many deaths were beginning to happen in different states, inspectors were immediately sent to the company where they now knew the poisonous effects. They sent out many telegrams explaining the urgency to return the sulfonamide elixir. The FDA then set out to receive all bottles of sulfonamide elixir. Locating the purchasers required lots of work since many clerks didn't know the name it was sold to or they didn't list their address. Victims of elixir sulfonamide poisoning, many of them children being treated for sore throats, were ill to about 7 to 21 days. All exhibited similar symptoms, characteristics of kidney failure, stoppage of urine, severe abdominal pain, nausea, vomiting, and convulsions. They suffered intense and unrelenting pain. At the time, there was no antidote or treatment for diethylene glycol poisoning. A mother of a victim who was a child wrote to Franklin Roosevelt in a letter saying, "The first time I ever had an occasion to call on a doctor for her, she was given elixir of sulfonamide. All that is left to us is the curing for her little grave. Even when the memory of her is mixed with sorrow, for we can see her little body tossing to and fro and hearing the little voice screaming with pain, and it seems as though if it would drive me insane. It is my plea that you will take steps to prevent such sales of drugs that will take little lives and leave such suffering behind, and such a bleak outlook on the future as I have tonight." The company went to court, and it was said if the product had been called a solution instead of an elixir, no charge of violating the law could have been made because the product was an alcoholic solution. After the incident, they had a pending act for a new update on the Food and Drug Act. A year later, in 1938, they implemented the Federal Food and Drug Cosmetic Act. As it turned out, the elixir experience did more than hasten enactment of the 1938 Federal Food, Drug, and Cosmetic Act. The new drug section added to prevent such tragedies gave the United States a new system of drug control which provided superior protection while stimulating medical research in progress.